Hey guys, welcome back. I'm Brown Chubby Bear for Political Bear Nation. Today we're going to dig into this 870-page monster, the so-called Big Beautiful Bill, which in reality is one of the most devastating attacks on working families in American history.
Political Bear Nation, ready to dive, where opinions spark and the debates thrive. Hold on tight.
When I was growing up, I was just barely learning how Reagan hurt poor working families, and then later, Clinton worked alongside Newt Gingrich and ended the federal safety net that had existed since the New Deal era and replaced it with TANF, the Temporary Assistance for Needy Families program. It was part of Clinton's 1996 welfare reforms, and it was disastrous. But the Big Beautiful Bill said,
"Hold my beer!"
Let's start with the healthcare cuts. The bill mandates over $1 trillion worth of cuts from Medicaid over the next decade, which is the largest cut to any social program in American history. The Congressional Budget Office estimates that 16 million Americans will lose health insurance by 2034. That includes 4.8 million people who will lose coverage simply because they can't navigate the new bureaucratic maze of work requirements. Yes, Republicans made it difficult on purpose and in many cases impossible for you to actually be able to prove you meet the requirements. And when you get kicked off of Medicaid, you no longer qualify for certain tax credits for the Affordable Care Act, cutting off any alternatives to get insurance at all. Republicans are also removing the so-called enhanced premium tax credits, which is projected to make coverage unaffordable for millions of Americans that rely on getting insurance through the Affordable Care Act. In addition to the new work and documentation requirements, there are now per-service copay fees, which could add up to $35 per service, which places another burden on families that are lucky enough to even keep their health care. So let me show you how these new work requirements could impact someone. Let's talk about someone like Carla. Carla is a single mother in Florida with a 5-year-old daughter. She works part-time as a nurse's assistant at a senior care center, but that senior care facility is struggling financially, and so they had to cut back her hours, so she only gets about 16 hours a week. To make ends meet, she supplements her income by driving for Uber for about 30 hours a week. In total, Carla works around 184 hours a month. That's well above the new federal minimum of 80 hours per month to qualify for Medicaid. Yes, the new requirement is now 80 hours per month. But here's the problem. Meeting the requirement is no longer enough. Proving it is now the barrier. Uber doesn't issue traditional pay stubs. It pays per ride, not per hour, and provides weekly summaries rather than a monthly documentation. Plus, Medicaid rules in many states, Florida included, that's where I live, now require all documentation to be submitted through an online portal that only accepts monthly totals with formal proof. While Carla should be able to screenshot her weekly summaries from Uber, Florida and other states will not accept this alone. Florida requires additional information, like bank statements, with the deposit from Uber to match her earnings report. And if she has lots of hours, but just a few rides, Florida will dispute her qualification status. During a busy tourism season, she might log hundreds of rides and be fine. But after a hurricane or a slow week, she could spend days behind the wheel without a single ride. That means even though Carla is working more than double the required hours, she can't prove she qualifies for Medicaid in the state of Florida. And because she can't prove it, she gets kicked off of Medicaid. And once she loses Medicaid, she also loses access to the subsidies offered through the Affordable Care Marketplace, even if her income still technically qualifies her for assistance. And let's say she does manage to have a perfect month with plenty of rides. How is she supposed to verify it? So despite doing everything right, Carla and millions like her are set up to fail because the system wasn't designed to verify reality. It was, in fact, designed to deny coverage. That's what Republicans called saving taxpayers waste and abuse. 59 million Americans perform some form of gig work, and about 7 million of them are on Medicaid right now. If you're a gig worker using Uber, Lyft, DoorDash, Instacart, Rover, or even Amazon Flex, depending on the state you live in, it may be impossible for you to document your hours to properly qualify for Medicaid. Now, when people don't have healthcare, what happens when they get sick? They use ER. Without Medicaid or the ACA, people stop seeing their primary care physician. Chronic conditions like diabetes or asthma go unmanaged. Eventually, people show up in the emergency room with advanced complications because of their diabetes or whatever they're dealing with. Maybe they even have a stroke or a heart attack because they weren't able to get regular care. These patients are uninsured, so the hospital isn't getting any Medicaid reimbursements when they show up and use the ER. The hospital ends up having to eat the cost, or it may ask the city or the state to compensate them. If the hospital isn't able to get funds from the city or the state, they will close their doors because they can't keep on treating patients for free. There are 742 rural hospitals in danger of shutting down. This will create health deserts where ambulance times increases, ER times increases, maternal and infant death rates increase, and tens of thousands of people end up dying with what should have been easily treatable conditions. And by the way, I know that I mentioned maternal and infant death rates increasing, but that's actually something the United States has already been struggling with, and this will only make it worse. Mind you, 64% of non-elderly, non-disabled adults on Medicaid are already working. They simply don't get paid enough to afford healthcare on their own. The sad part is that the MAGA Trump-loving base, which on average makes less income and tends to live in more rural areas than Democratic voters, are going to suffer the most. Even if they're not on Medicaid themselves, their hospitals that are close to them will close. That's the shitty thing about these changes. It will affect everyone, regardless if you are on Medicaid or not. But MAGA doesn't believe it will affect them, until it does. And Republicans have done a great job of making sure voters will not understand why they are suffering. Now, I'm going to talk about that more in just a few moments, but this is probably a really good time to ask you to subscribe. This video is just the first of many breakdowns of this bill. You're going to want to stick around for the next video. But let's get back to talking about the healthcare problem and specifically the medical school crisis. Americans face a projected shortage of nearly 188,000 physicians by 2037. This bill makes the crisis even worse. The legislation imposes a $200,000 lifetime cap on professional school loans when the median cost of medical school is over $286,000. And if the student goes to a private medical school, they're spending almost $400,000. And the bill eliminates Graduate Plus loans entirely, which about 80% of medical students rely on. That means unless you come from a very wealthy family, you simply cannot afford to become a doctor anymore. At precisely the moment when we are desperately in need for more physicians, we are making medical education a privilege exclusively for the rich. We have a growing elderly population and they need care, while fewer young people are entering medicine. Doctors are aging too. Many are over 65 and are planning to retire soon. Cutting access to medical education now means fewer new doctors exactly when we need them the most. We're already facing issues in rural healthcare, creating primary care deserts and long hospital wait times. This just compounds all of that. Rural America, who statistically voted for Trump in much higher numbers, are going to feel the effects the worst. MAGA is literally cheering on their own deaths. Now, let's talk about SNAP, the Food Assistance Program. The One Big Beautiful Bill includes a devastating 30% cut to SNAP, the nation's primary anti-hunger program, a reduction that is twice the size of the 1996 welfare reforms that I mentioned earlier in the beginning of the video. Just like with Medicaid, this bill introduces expanded work requirements for SNAP recipients, but it doesn't stop there. For the first time in SNAP's history, states will be required to pay a share of food benefit costs starting in 2028. Over the next 10 years, the bill is projected to slash $300 billion in federal spending. According to the CBO, those expanded requirements will push millions of Americans off the program, not because they're unwilling to work, but because they won't be able to prove that they met the new requirements. Under previous rules, parents with children under 18 were exempt from work requirements. Now, that exemption ends when your child turns 14. Previously, if you were 55 or older, you were also exempt. But under this bill, the work requirement now goes up to 64.
Check out the name tag. You're in my world now, Grandma.
Oh, dear.
Come on, Grandma, get to work. A large share of SNAP recipients are people who aren't expected to work at all. Children, seniors, and people with disabilities. But among working age, non-disabled adults receiving SNAP in any given month, more than half are already working. In fact, 89% of families that rely on SNAP worked during the 12 months before or after they received assistance. Republicans would have you believe that the reason why so many Americans depend on SNAP is because they're lazy and that your tax dollars help fund that laziness.
If you're a young, able-bodied, healthy American man, 26 years old, you don't even want to go to work, you can get on Medicaid.
Medicaid, yeah.
It's blowing a hole in the budget thanks to Barack Obama. You could live at your parents' house, play softball on the weekend, sell ecstasy on the side, not even look for a job.
I like
And
this.
you can get free health care. That's what they're doing. They're just closing that lazy loophole.
Republicans would have you believe that the reason why so many Americans depend on SNAP is because they're lazy and your tax dollars help fund that laziness. But this isn't about laziness, it's about instability. These aren't people refusing to work. These are people who can't find consistent work. SNAP exists to help people bridge the gap when their hours are cut or their jobs disappear or wages just aren't enough to cover the cost of food. But the bill is designed to ignore that reality. I just walked you through how brutally difficult it's going to be for millions of working Americans to prove they meet the new requirements to qualify for Medicaid. The same is going to be true for SNAP. And because of that difficulty, more children will go to bed hungry. That's not just a hypothetical. That's a predictable, calculated outcome of this bill. Currently, 14 million children go to bed hungry right now. These cuts will only exacerbate that problem. And honestly, I don't know how anyone who signed this into law can look at themselves in the mirror. I really don't. You literally wrote it to stop 5 million Americans from eating, including 800,000 children who now face losing some or all of their SNAP benefits.
You suck!
Before we gave SNAP exemptions to veterans too, but nope, like I've told you since I've started this channel, Trump does not care about the people in the military, and neither do Republicans. The loss in benefits are going to hurt American children the worst, but farmers are also going to lose about $24 billion over the next decade. Where do you think that food that SNAP beneficiaries eat come from? American farmers. Food banks aren't going to be able to cover the difference. Children are going to go hungry. Farmers are going to go out of business. And elderly Americans will either starve or be forced to eat cat food. And for what? So Trump can make his tax cuts permanent for millionaires and billionaires? While claiming to help working families, this bill provides over $4.5 trillion in tax cuts, with the majority flowing up to the wealthy. The top 1% receive an average tax cut of $63,000. The top 0.1% benefit even more, averaging around $103,500 every year. Over 70% of the total tax relief goes to the top 20% of earners. Households earning under $23,000 a year actually lose about $1,600 annually, largely due to the tax credits and benefit reductions. Now, the bill does include a no tax on tips deduction for tipped workers, like servers, bartenders, and stylists, but it only applies to tips up to $25,000, and the provision ends in 2028, while making the Trump tax cuts for billionaires permanent. It also does not remove payroll taxes, so workers will still have to pay Medicaid and Social Security taxes on those tips as well. Thought you'd save a lot with the no tax on overtime? Nope. Workers can deduct up to $12,500 in overtime pay, but that also ends in 2028. The math works out like this. If you're a tipped worker, which is about 2.5% of the workforce, you'll see about $1,675 in tax savings for 2 years, and then those tax savings end. If you get paid overtime regularly, which is about 5% of the workforce, you'll see about $1,400 to $1,700 in tax savings for 2 years, and then that ends. Earlier I said I'd explain how this bill is structured and why the tax cuts for the rich kick in immediately while the spending cuts are delayed. So let me break it down. Trump's tax cuts for the wealthy are both permanent and immediate, no delay, no waiting. But the spending cuts are staggered. They start in 2027 and continue to 2034. That means the full pain of those cuts doesn't hit now. It gets dumped on future generations. Meanwhile, the ultra-wealthy get their money right now. This structure is exactly why the bill adds $3.3 trillion to the federal deficit by 2034. It's not about balancing the budget, it's about handing out tax breaks now and having your children pay for those tax cuts later. This delay will confuse accountability and mask the source of the damage, making it hard for the average American to understand what caused their hospital to close, their SNAP benefits to shrink, or the Medicaid to disappear. Republicans will campaign on lower taxes and a booming economy heading into the 2026 midterms, but the new Medicaid and SNAP work requirements won't start going into effect until 2027. Hospitals, especially rural ones, will start collapsing financially, but all of this will happen after 2027, after the midterms. The design of the Big Beautiful Bill is politically strategic. It delivers immediate tax benefits to the wealthy and corporations right now, while the painful cuts to healthcare, food aid, and public services are delayed, making sure Republicans can deny any responsibility or accountability when Americans start suffering. So if you're saying to yourself, this sounds horrible, why would moderate Republicans even vote for it? Well, essentially, they were bribed. The most brazen example of political corruption in this bill is what Republicans did to buy Senator Lisa Murkowski's vote. After she initially opposed the legislation, calling it harmful to Alaskans, GOP leaders literally rewrote the bill for her state specifically. They quintupled the tax deduction for Eskimo whaling boat captains from $10,000 to $50,000 a year. Yeah, you heard that correctly. While millions lose health care, we're giving bigger tax breaks to about 150 whaling captains in Alaska. Alaska also gets $9 billion for Arctic icebreakers, the largest Coast Guard investment in history, directly benefiting Alaskan ports and shipyards. While other states face harsh work requirements for food assistance, Alaska gets to waive those work requirements when their unemployment is high. She was even promised special considerations to help her hospitals stay open, while other hospitals throughout the country shut down. She could have voted no on this bill, but she sold out America. Fuck you, Murkowski.
Senator Paul said that that your vote was a bailout for Alaska at the expense of the rest of the country.
Oh my.
That's what Senator Paul said.
She wasn't alone, though. Senators from West Virginia and Alabama secured $2 billion over the next decade by getting metallurgic coal, a special type of coal used in the production of steel, reclassified for the Advanced Manufacturing Production Credit. In fact, Senator Jim Justice, what a hell of a name, and his family own and deeply profit from Bluestone Resources, a major metallurgic coal company, which raises serious conflict of interest concerns given the new coal-friendly provisions in the bill. But hey, we allow President Trump to sell smartphones and Bitcoin. It's not like we give a shit about conflicts of interest anymore. Now these senators can go back home and tell their voters that while everyone else in America lost out, they were able to carve out special arrangements at home. And Jim Justice? Well, he can go back home with a fatter wallet than he had before. He made much of his fortune from inheriting his father's coal business, and just like Trump, his daddy made him a billionaire. But he wasn't very smart, just like Trump. And he lost $850 million investing on a luxury retreat. Kind of similar to Trump, honestly. Luckily, he was able to abuse his position as senator and make himself richer. This bill doesn't just remove safety nets for healthcare and food in order to give millionaires and billionaires permanent tax cuts. It also furthers Trump's goal of creating a national police force that is loyal only to him. The immigration detention industrial complex gets a whole lot worse with this bill. In a previous video, I have talked about how CoreCivic and Geo Group are generating billions detaining immigrants. They keep building new detention facilities, and they all need to be filled with bodies. Since Trump took office in January, ICE has booked over 204,000 immigrants into detention. That's a huge increase even compared to Trump's first term, where he detained roughly 220 immigrants a day. He was up to 650 immigrants a day when he first started, basically his first 100 days, but now he's detaining over 1,000 immigrants a day. And this was all with ICE being broke, apparently. Now they have almost unlimited resources. This bill allocates $170 billion over the next 4 years, including $45 billion for building new immigration detention centers, a 308% increase in annual detention funding. If you were to annualize their budget and classify ICE as a military force, it would be the 11th largest military in the world. This bill sucks, and it will suck for everyone that isn't super rich. But not all states will suffer equally. Louisiana faces the most severe rural hospital crisis, with Medicaid cuts threatening hospitals already operating on razor-thin margins. Louisiana will lose about $3 billion in federal Medicaid funding per year, and over 200,000 residents are projected to lose some or all of their SNAP benefits. Texas is going to suffer big time. The Big Beautiful Bill shifts both benefit and administration costs of SNAP to states beginning in 2028. Texas is projected to spend an estimated $806 million in new SNAP obligations starting in 2028 and an additional $2.8 billion a year in additional Medicaid spending. There's no way to sugarcoat it. This bill is one of the worst pieces of legislation I've ever seen in my lifetime. But there's a way we can minimize the damage. If the Democrats control the House, the Senate, and the White House, we can repeal either bits and pieces of the bill or the entire bill in its entirety. But that's going to require huge Democratic victories starting now and all the way up to the 2028 presidential election. Democrats have to try and reach the 86 million people who did not vote in 2024 and get them to vote early, to vote local, and vote often. And if we want to attract voters that are too pissed off to get off the couch, we need to energize them. And we can do this. In Albany, just last month, New Yorkers voted in the first black Democratic mayoral nominee, thanks to a 3-year grassroots campaign dominating 14 of 15 wards. Zoran Mamdani, who I talked about last week, won the Democratic primary over Andrew Cuomo. Mamdani was polling at just 1% back in February. It was the highest turnout since the 1980s. We can do this, but we have to energize young progressive voters. Check out last week's video about Mamdani, or the video about Leonard Leo, the man who rigged the Supreme Court. Until next time, this is Brown Sugar Bear for Political Bear Nation.